This is a presentation on how to improve sitting comfort in a person who has developmental asymmetry of the pelvis. Now, Victor did present with hypomobility in his sacroiliac joint on the left side, but we treated that and now his motion is normal throughout his pelvis, but he has a little bit of asymmetry in which the right front of the pelvis, called the ASIS, anterior superior iliac spine, is lower, and the shelf right above that is lower on the right. And it's developmental, and the reason I can say that is because every single passive spring test that I do demonstrates good mobility. And he has good mobility going sideways either direction. Let's have you lie on your stomach. And he has good upward mobility. This was stuck yesterday, but we treated it. He has good forward rotation. He has good inferior rotation. He has good lateral mobility. He has good medial mobility. All the spring tests on the sacrum demonstrate normal ability. And if it was stuck, as it was yesterday, I wouldn't be able to take the slack, okay? But you should be able to push on the bony pelvis and get a little bit of movement to where it stops, and then you should be able to thrust and get a little extra movement and spring in that joint. When he's prone, it's very subtle. I can't tell you that there's an asymmetry of the iliac shelf. I can't say that. I can't say that these bumps are asymmetrical. But when I come down to the sit bones and I go inside the sit bone, you can see that the crease of his pants matches the gluteal crease, okay? And I'm sticking my thumb just inside the sit bone, and you can see there's a lot more space on the left-hand side, okay? This is how he's made because he has normal medial mobility, he has normal lateral mobility, and so all of these spring tests, and they're all listed in YouTube under my last name, and which is Hesch, H-E-S like Sam, C-H, and then the word spring tests. You'll see all the different spring tests that we do on the pelvis. But I've tested him for all of those, and what we're left with is a pelvic asymmetry with normal mobility, so that's the way he's made. Well, people with pudendal neuralgia, some of them have a developmental asymmetry, but when they sit in a chair, the chair forces their body into a false symmetry, and sitting can be uncomfortable for them, okay? There is a pattern that's common with people with pudendal neuralgia, and it's called lower windswept pelvis. You can look that up and use my last name, Hesch, H-E-S like Sam, C-H, lower windswept pelvis. You can find that on YouTube. He looks like a windswept pelvis, except again he has normal motion, okay? So when he sits, he's sitting on an uneven pelvis, okay? But the chair tries to throw him into symmetry, which really makes him even more asymmetrical, okay? And that can increase discomfort. So let's have you come and sit in the chair. And what I do is I make sure the feet are together. Good. Knees are together, and looking at your thighs, the left thigh is higher towards the ceiling, and it's also longer, okay? And what we do is we take craft foam. You can buy it at Hobby Lobby or Joann's Craft or Michael's or online. This is 5mm, almost 1/4 inch, okay? And I'm going to put this under your sit bone because your right sit bone is lower than the other one, okay? And we did this experiment yesterday. We also put it on the other side, and we noticed that the height is much improved and the length is much improved as well, okay? Tell us how you feel sitting without it, and tell us how you feel sitting with it.
There's a noticeable difference. I think you hit it right on the nail with the height. When it with it, seems level,
Uh-huh.
seems a little more balanced.
Nice.
Without it, I seem to naturally be placing a lot of my weight, and I experience this when I drive to work, a lot of my weight on the right side.
Yeah, yeah.
This seems like even weight distribution
Beautiful.
on both bones.
Nice. And he's a pilot, so it's so important for you to have sitting comfort so you're not distracted from the task at hand.
Right.
Beautiful. Okay. So, and I tested your hip, and we tested propping propping foam underneath each trochanter, and that did not have the same benefit as this had.
Correct.
So now let's switch places. Let's bring your wife over here.
Okay.
And so it's a $2 solution for the craft foam. So his wife has symmetry of her pelvis, but she has asymmetrical development of her hips. So we tested having her sit on this under one sit bone and under the other. Didn't really make a difference. And then this is a piece of foam that I use. I dip it in rubber dip, and we placed it up and down, lengthwise, under the trochanter of the hip. Okay? And tell us what that does for you.
Feels great, feels more even,
Nice.
takes off that achy pressure or the need to feel like I need to pull it up.
Yeah,
inward.
yeah. So before you were just
Anything,
intuitively trying to accomplish
A
this.
scarf, a jacket, a pillow, an ice
Something.
pack, something,
Nice.
anything.
Nice. And you can use a washcloth. So you just fold it twice, okay? And then just roll it up tightly. And then you can use a rubber band or tape on it. And I would keep one in the car. And I would keep one at home for your computer desk. And if you work and you sit at work, then you can have one at work as well.
Feels
you know,
great.
and then another one in your purse. Then when you go to a restaurant, then you have it. The tricky thing is you just have to remember when you leave the restaurant, take it with you.
Yeah.
It's easy to
Feels
forget.
great.
Nice. So this is a presentation on how to improve sitting comfort in people with or without pudendal neuralgia who have a developmental asymmetry of the pelvis in which all motion through the pelvis is normal. If it's not, then hopefully your physical therapist can improve that motion. And it's also a presentation on a developmental asymmetry of the hip joint, improving sitting comfort. I hope this is helpful. Thanks.